Starting with alcoholism, that is inebriant poison, that is going to be a CNS depressant. So starting with the first thing, that is going to be the methanol. So methanol, it is also called as illicit liquor, or it is also called as the wood alcohol, or it is also called as wood spirit. Now, very important, what are the features of methanol? It is completely colorless in nature. Then taste, it is going to have a burning sensation, and it will have a peculiar nauseating odor. A peculiar nauseating odor will be seen. Now, talking about the metabolism of methanol. So metabolism of methanol is pretty easy. The methanol will be converted to formaldehyde, and formaldehyde will be further converted into formic acid. The fatal dose. So fatal dose of methanol is about 60 to 100 ml. So 60 to 100 ml is the fatal dose, while the fatal period is about 24 hours. Now the clinical features. So in the clinical features, we can see in the vision, it can lead to snow vision. So snow blindness or snow vision can be seen. So there will be frank blindness or blurring of vision can be present. So optic nerve, so there is an atrophy of the optic nerve that can be seen. Then the pupil will be dilated. Then apart from that, the optic disc it will show papilledema in nature. The light reflex will be sluggish, or it will be decreased. Talking about the CNS and CVS, so in the CNS and the CVS, it will lead to basically hypotension and tachycardia will be seen, convulsions, coma, and all those things. And talking about the metabolism, so in the metabolism, the methanol, it leads to hagma, that is high 9-gap metabolic acidosis is seen. Then diagnosis, when the blood levels they are more than 50 mg/%, then that is considered to be a severe poisoning of methanol. Now, the Hoosh tragedy, very important. The Hoosh tragedy, it is related to the accidental consumption of methanol. Now, treatment. How will we manage the patient of methanol poisoning? So we have to manage it in a quiet and dark room. Protect the eyes from light. Airway, breathing, and circulation needs to be managed. Then gastric lavage, it is given with sodium bicarbonate. Why sodium bicarbonate? To manage this metabolic acidosis. Then what is the antidote? The specific antidote for methanol poisoning is the ethanol. The adverse effect of ethanol is that it itself leads to intoxication. The drug of choice is going to be the fomepizole. The advantages of fomepizole is that it can be given IV, and apart from that, there is no intoxication like the ethanol. But however, this is not readily available. Talking about a folinic acid, that is vitamin B9 injection. So what does this folinic acid helps in? This folinic acid helps to remove the formic acid that is formed inside the body via the urine, and hemodialysis can be done. And on the autopsy, we'll find the edema, cerebral edema, pulmonary edema, retinal edema. Now coming up to the alcohol. So in alcohol, what are the properties of alcohol? It is clear, it is colorless in nature. Odor, it gives a typical fruity odor, and this is mostly because of this congeners. So what are congeners? These are the ones who impart the taste as well as who impart odor to it. So congeners, they are the sugars of the fruits or the veggies which are going to get fermented and going to give taste and odor. Then it is amphiphile in nature, that is, it is both lipid soluble as well as water soluble in nature. Fermentation, it halts at 15 degrees Celsius because the yeast dies after this. So types of beverages, there are malted liquors where fermentation is present but there is no distillation, and the concentration is very low in case of malted liquors. The malted liquors, they consist of beer, stouts. These are going to be the examples of this. When talking about the wines, here also the fermentation is present but the distillation is absent. The examples of it are the light wines, fortified wines, and effervescent wines. So light wines where the concentration is low. So in the light wines, it includes your claret. It includes the claret, cedar. In the fortified wines, it includes the port, then sherry, and effervescent wines will give effervescence. Obviously, that is champagne. Now talking about the spirits. Spirits are the one which consist of a high concentration of alcohol. So the concentration over here is about 40 to 55%, consists of rum, whiskey, then vodka, etc. Now types of alcohol. Again, the types of alcohol. So the types of alcohol. So the types of alcohol, they include the absolute alcohol. Absolute alcohol, it consists of 99% alcohol. Rectified alcohol consists of 95% alcohol, and denatured alcohol consists of 90% alcohol and 5% methanol that is added to it. Then the uses of alcohol. So uses of alcohol, it can be used for the beverages, it can be used for medicinal purposes like in Ayurvedic medicine it is used, or it can be used for any other conditions as well, as a disinfectant as well. In absorption, 20% of the absorption it takes place from the stomach, the 80% absorption it takes place from the small intestine. Most common absorption it takes place from the duodenum and jejunum. Now all the absorption it undergoes the gastric first pass metabolism. After the gastric first pass metabolism, it undergoes because of the presence of gastric aldehyde dehydrogenase. Then it is absorbed into the portal vein. The portal vein it goes to the liver. In the liver, then the saturation is made early because of low levels that only the saturation is made. So this is very important to know. Then the conditions. So you should know what are the conditions that lead to decrease absorption, or the conditions that lead to increase absorption. So the conditions that increase the absorption is that when the alcohol is taken in an empty stomach, when warm alcohol is taken, or when alcohol is taken with the Sprite or some cold drinks like this. Then decrease in absorption. So decrease in absorption it is of alcohol. It is seen when it is taken with soda, it is taken with fatty diet, or a protein rich diet has been taken earlier. And also there is a decrease in absorption when it is taken with the cold ice cubes. Then very important in surgeries like in gastrectomy as well as in vagotomy. So in gastrectomy and vagotomy surgeries there is an increased absorption of alcohol seen. Next, the next topic is alcohol intoxication. So alcohol intoxication is a state that is associated with behavioral, psychomotor and cognitive changes in an individual. So what are the stages? There are three stages: the stage of excitement, the stage of incoordination, and the stage of coma. So stage of excitement, it consists of three stages. So the first is the cognitive stage. There is a loss of cognition at more than 30 milligrams per dl. Then there is a reaction time. So reaction time decreases at more than 50 milligrams per dl. And lateral gaze nystagmus or alcohol gaze nystagmus, it is seen at more than 80 milligrams per dl. At the stage of coma, there is a Mackey-1 sign. What is Mackey-1 sign is that whenever a harsh stimulus is given, that is when we pinch the skin or tap the person, then in that particular case we can see that the pinpoint pupil it is dilated and again comes to the pinpoint. So this is how we can differentiate between morphine poisoning and alcohol induced coma. Then what are the different stages? So the first stage, it is given by the mnemonic CCSC. So the first is 0 to 50 milligrams per day, that is called as the sobriety, where the person is sober. Then from 50 to 100 it is called as the stage of euphoria. In the stage of euphoria, the person is in a overall sense of well-being. Then there is going to be increased self-confidence and all these things. Then in 100 to 150 there is a stage of excitement. In the stage of excitement, the person has a lot of self-confidence, can do indulges in a choral or is extreme talkativeness is seen. Then it's a stage, then in the concentration of 150 to 200 it shows. So the C stands for the confusion or incoordination. So in the confusion incoordination, there is a muscular incoordination. Then there is a loss of fine skills. Then talkative. Then the perception is changed. Then slurred speech. Apart from that, staggering gait, confusion, and all these things, visual disturbances they are seen. Then at 200 to 300, there is a stupor. Stupor, that is decreased response is seen, and more than 300 it is coma. So in the coma, obviously the person has unconsciousness, abolished reflexes, subnormal temperature is seen, and very important, urine and fecal incontinence is seen. The next condition, then what is the differential diagnosis for the poisoning, alcohol intoxication? It is barbiturate poisoning, or it can be diabetic coma, it can be hypoglycemia or something like that. So very important is barbiturate poisoning or head injury or coma, diabetic coma. Now what is the management? The management includes the ABC, that is airway, breathing, circulation. Apart from that, rule out the head and spine injury. Thiamine uh, 100 milligrams IV and glucose 20 to 25 grams is given. Then manage hypothermia and assess the status of acidosis in that individual. So these are going to be the management protocol for alcohol intoxication. Apart from that, the drunkenness. So drunkenness is a condition produced where a person takes alcohol in a quantity sufficient to cause him to lose control of his faculties to an extent where he is not able to execute the occupation he is engaged in at that time. Now, the first important type problem is, should we take the consent of the individual? If the individual is brought by the police and if he is under arrest, then under section 53 subsection 1 of the CRPC, it gives you the right to conduct the examination. But if the person is not under the custody, if he is not under arrest, then you have to you can, if the person is conscious, then you can give the consent. But if the person does not have a sound mind, then you can go with the examination, but the results, they are given only after the retrospective consent of the individual, that is only after the individual is normal. Then physical examinations, general appearance, you have to see the state of the clothing, whether it's soiled or not, then the behavior, orientation of the person. Record the vitals. It is generally seen that the vitals, that is the heart rate, is found to be increased, the respiratory rate is found to be increased, as well as the BP. The BP is, first it is decreased, but as the patient is brought to you, the BP increases with the dose. Then the speech, you have to assess whether the speech is normal, thick, slurred, or over precise. In case of incoordination of the muscles, that is above 150 milligram per dl, you can easily come to know if it's a slurred speech and the person tries to speak in an over precise manner. So this thing has to be ruled out by using the different difficult phrases. Then breath, you have to look for the smell, and this smell is generally comes from the congeners. Then stance, that is the Romberg sign. In the gait, there's a normal gait or staggering gait that is seen. So you also ask the patient to turn suddenly. When the person turns suddenly, check the reaction time. If the person is under the influence of alcohol, then it takes time, or it takes 2 or 3 steps for the person to change the direction. Then assess the writing of the person. Then look for the eyes. For example, the conjunctiva, it is congested in alcoholism. Then the pupils, they are dilated. Then the pupillary reflex is diminished or sluggish, nystagmus is seen. Then take the samples. So samples it consist of a blood sample and urine sample. So the blood sample, it should be taken without the use of spirit. Then 5 ml of the blood sample is taken. In that 5 ml, 5 milligrams of sodium fluoride is used. It inhibits the enolase enzyme activity. Then 15 milligrams of potassium oxalate is taken. The potassium oxalate is going to be an anticoagulant over here. Urine samples 2 are taken. One taken, and the second is taken after 20 to 30 minutes. It takes whether the phase of absorption is present or the phase of elimination is present. Now, very important, if the concentration in the blood is 1 milligram percent, then the urine it is 1.3 milligram percent, the vitreous it is 1.2, and the CSF it is 1.1, and the brain it is at 0.85 milligram percent. Then you have to give the opinion of the drunkenness, that is the patient is not under the influence of alcohol. Then the opinion B can be, it is in the presence of he has had alcohol but not under the influence, and the opinion C is he has had alcohol but and is under the influence. Then the next is the Widmark's formula. So Widmark's formula is A is equal to PCR. So it is A is the amount of alcohol, then P is the body weight, then C is the concentration in the blood, and R is a constant. For females it is 0.55, and for males it is 0.68, and A is the amount of alcohol. What is the clearance of alcohol? So we know the clearance of alcohol is 15 to 20 milligrams per hour. The breathalyzer is also called as the drunkometer, or it is also called as intoximeter, or it is also called as alcometer. Now this breathalyzer can be used according to the Motor Vehicle Act section 185. It is based on the principle of Henry's law, and the ratio over here is 2100:1. What does this mean? According to here, the amount of alcohol which is present in 2100 ml of alveolar air, that is equal to alcohol which is present in 1 ml of blood. What are the errors that can be seen in the use of ethanol containing products? If belching or regurgitation is present, inadequate expiration. If the patient is using MDI having steroids or COPD, it can give false positive results. Now, In road traffic accidents, there's increased risk-taking behavior in case of alcoholism, decreased reaction time, decreased cognition, tracking में problem आता है, and in the vision there is a blurring or decrease in visual acuity that is seen. Saturday night pulse is generally seen because of binge drinking that is seen during Saturday, and that can lead to brachial palsy. Then this is going to be a snapshot of alcoholism. This is a disorder characterized by excessive drinking that results in injury to person's health or inadequate social functioning. Alcoholism leads to increased tolerance, increased dependence, taking large amount of alcohol. That is called a dipsomania. That is irresistible desire to take large amount of alcohol. Then great deal and money on alcohol, giving up important activities, inability to perform major obligations, or incurring legal problems. The complications of this are the serious complications related to hypertension, cardiomyopathy, holiday heart disease. And CNS, it leads to alcoholic palimpsests. Alcoholic palimpsests, this is blackouts. Then the sleep, Wernicke syndrome, Wernicke-Korsakoff. Then cerebellar degeneration, Marshall-Falk syndrome. What is Marshall-Falk syndrome? It is seen in males. In male red wine drinkers in Italy. And what is this Marshall-Falk syndrome about? It is about corpus callosum atrophy. In the GIT, it leads to ulcerations, bleeding, Mallory syndrome, pancreatitis, fatty liver, cirrhosis, hepatitis. Genitourinary, it increases the sexual desire but it decreases the performance. Testicular atrophy. Nutrition, increase in vitamin B1, B6, B7. And then hematopoietic, increases the RBC size. Hypersplenism is seen. The fetal effects is that it leads to fetal alcohol syndrome. The cause of death is liver, obviously it leads to cirrhosis, liver failure and all these things. Then withdrawal. In the withdrawal, there are 5 important things that are seen. First is the in 0 to 6 hours abstinence syndrome, that is characterized by the tremors, and then after that hallucinations for 12 hours, where there is a persecutory delusions, that the person feels that he is going to get persecuted. So suicidal or homicidal impulses are seen. Seizures in 24 hours, and delirium tremens in 3 to 5 days. Clouding of consciousness, disorientation, agitation, vivid hallucinations, restlessness, shouting, tremors is not held responsible for this, and this is by 22 BNS section. Wernicke-Korsakoff syndrome, that is anterograde amnesia, where the person is not able to learn new things. Mild retrograde amnesia is also seen. Management is aversion therapy. Disulfiram, it inhibits the alcohol dehydrogenase, and because of which the aldehyde syndrome is seen. It gives unpleasant reactions to the patient, and the patient will himself move away from these things. The very important medical legal implications. The section 23 of the BNS or 85 of the IPC is about involuntary alcoholism, where it is not awarded any punishment. 24 of the BNS or 86 of the IPC is about voluntary alcoholism, where the punishment is awarded. 510 of the IPC, or the drunken person in the public space, if he does any misconduct, or 355 of the BNS, in that this particular person will be given 24 hours of imprisonment and 1000 rupees fine. And Bombay Prohibition Act, it gives reasonable grounds, and the person is produced for medical examination. So this is all about the alcohol and inebriants.